Dear viewers, you are with me today in the Alice in Wonderland podcast series, and I'm going to talk about this subject which is so important for all of us. So I want to tell you, you can be beautiful, and that is the subject and that is the topic in discussion today. And I would like to start by saying that everyone says that beauty is in the eye of the beholder. But is it so? To me, I think beauty is in the hands of the woman who wants to decide what she wants to do for herself and how she owns that beauty. Okay? Of course, I would like to introduce our guest today, and I want to start off by saying I like the woman that she has become rather than the girl she was when I first met her. And of course, I like what age has written on her face. Okay, so age has written beautifully on her face, and I would like to introduce none other than Li Kim. Well, how can I explain what Li Kim is? Okay, Li Kim was a very popular TV series host by the name of Paranormal Zones. Am I correct in saying that?
Zone,
yeah, the Paranormal Zone. And I think since 4 years now, she has stopped it, maybe due to all the NCOs and other ghostly things happening to us around.
Covered enough ghosts.
Yeah, so now she does a lot of things and she does nothing. And like what she told us, when she gets bored, she walks over to my clinic. Okay, so let me talk to Li Kim about what is beauty. Okay, to me, as a doctor who has specialized in cosmetic surgeries and aesthetic procedures for the last 25 years, 20 years in my private practice and 5 years before that studying to be a cosmetic surgeon and dermatologist, I have actually thought of it as something very positive, something that I can give to women and even men, in that I increase their positivity, that I increase the happiness in their life, I increase the way that they feel about themselves. And if I can make one person that much happier, that much more confident, that much more self-esteem that I can produce in them, I'm happy about it. And that is why, guys, I love my job. Okay, so we are going to talk about many other issues, the way cosmetic surgeries and medical aesthetic procedures have improved or not during the past 20 years, and also about what is the norm now, what is the mistakes people are doing, what is the public's perception on this. All of this I'm going to be talking with Li Kim. So Li Kim, what is beauty to you?
I think beauty is very personal, yet it is personal, it's also subjective. I think for me, generally, off the cuff without scientific words and stuff, I think beauty is something that is within as well as outside. And what's more important is true beauty is the balance of both. I think that you shouldn't be excessive or obsessive with the external beauty and then neglecting to develop the inner beauty. So I think that balance is very important.
Yeah, but what do you think of the society that sometimes makes it look like if someone has done something for themselves on the external, maybe they lack something internally. They have to I think it's a thing that I have been trying to fight against all these 20 years. And though public perception has changed to a certain extent, I find still to a large extent people do think that, there's something lacking inside. If you are done something to make yourself look different, that means you also want to change what is inside,
But that's all. People are entitled to that view. They are entitled to their point of view that if a woman or even a man decides to do any improvements on their beauty externally, that there's something wrong internally. I don't necessarily agree to that because I think it's a choice. If someone chooses to study a certain field. If someone chooses to study psychology, does that mean that that person is psychotic?
Good point.
You know what I mean?
Yeah.
And if a person studies medicine, does it mean that they are so sick? No, right? So if a woman or a man decides to improve their external appearance, it's a choice. It is a choice. And they shouldn't be shamed for it. They shouldn't be ridiculed for it. It's a choice. And people are entitled to choice, to choose. And there are people who believe in natural beauty. Not me. I think if you leave it to nature, you will age and you will wrinkle and your collagen level drops, so your skin sags. And if you're okay with that, so be it. But if you're not okay with that and you can do something about it, and there are options today, go for it.
Yeah, like I myself, I have aged over the years, but I do things for myself. And when I do look at myself, and I know that I've done something positive against the ravages of time for myself, and it does make me feel better about myself. And I think it's also because I'm quite intelligent and, well versed in that way.
You are intelligent, okay? I look at my face, I know you're an artist.
So I try to choose those treatments that will make me look nice, but not, excessive. And this is why it's a privilege for me, ladies and gentlemen, to be in this field, to get to know my patients like Li Kim personally, over the years, to know their likes and not likes, and to know their face in society, and their family background, what kind of work they do. And these are all important considerations for me. But do you think the ideals of beauty changes with time? I think you did mention that it does, but how much so? And with that, the perception, how the society perceives someone who ages, does it necessarily have to be, do we have to look our years,
I think, I've been coming to see you since I was 36.
Yep.
I'm 50 years old now. I don't look too bad. I know 50-year-olds who probably look better than me, but I like how I look. I know it has taken maintenance. I have spent money as well, and I have been Dr. Alice client.
Yeah, we still call them patients.
Yeah, product for the last, my maths is really bad, 13 years.
Yeah.
Okay, the point is this. If you're not happy with yourself externally, yes, it could reflect what people would say, you don't like yourself, so something's wrong inside. Yes, it can be a way, and I think that when people are obsessive or excessive, or shall we say addicted to cosmetic surgery, and they just can't stop changing things and putting things in and eventually not looking like themselves, then I think there is perhaps some self-loathing or something you really dislike strongly.
Yep.
But I feel that when you improve on yourself, like in my case, I always say when I was 40, I said I don't want to look 30, I want to look like a good 40. So today I'm 50, I don't want to look 40, but I want to look like a good 50.
Yeah, I think this is the aim. I mean, all responsible people should consider all the different aspects. First of all, you need to realize that if you have deep-seated issues with self-confidence or self-esteem, cosmetic surgery is not going to change that, But if you feel your happiness, your confidence, your interaction with your family, with your husband, your spouse, with your children, with the society would improve by something that you do, then I think that is a very responsible choice to take that on. And then expectation is another thing. You need to, intelligent people know that expectation is as per what you do. You see, now the whole cosmetic industry has changed, shifted. It's no more a quick fix kind of thing. It's no more the prima donna thing that where only the funny people went and did plastic surgeries, and then they went to Switzerland and stayed in an asylum for a couple of months, and then they came back having all the work done. They got themselves fixed from top to bottom, and then they looked completely different and a bit freakish, scary. But now things have evolved and there's so many choices available. So I think we are going to next discuss about what choices are available for people right now, how over the last decades things have changed for the better or not, when we come back. Okay viewers, I read this article and I want to discuss that with Li Kim. Okay, ready? Why do we shame women for plastic surgery, and why it is important that we stop shaming women? Okay, so I was discussing this with Li Kim, right? And Li Kim said, so many people, and she said this rightfully, so many people are very confused with what is plastic surgery and what is cosmetic surgery or aesthetic treatment. So before we launch into this discussion, let me just clarify. Okay, plastic surgery is something like a reconstruction, where you can change your nose to anything you want. You can change your face shape from my face shape to look like Li Kim's and hers vice versa, and you can change your body shape like Kim Kardashian's butt, for example. You can actually make it super big or super small. These are the kind of plastic or reconstructive. You're making complete differences in a person. Whereas aesthetic treatments are a little bit more of this generation, I think. So they are a little bit more modern and they tend to focus on doing changes, incremental changes in your beauty. Okay, so this can be quite a holistic approach as well, and we will change things gradually by doing any minor procedures. It could be a Botox to reduce the wrinkled appearance of the skin. It could be a filler or a collagenizer to boost up the collagen, and then again the device market has made it all the more interesting. So over the last 20 years it's been a very exciting journey in that we have so many different kind of equipments come in, and we will be talking more in detail about some of these treatments as well later on. But what do you think of this article, Li Kim? Why do we shame women?
I think it comes from ignorance. When you shame anyone or ridicule anyone, the person who is ridiculing or shaming, I think, is ignorant, and also disrespecting personal choice. Of course, we can be dramatic and say that, if you hurt my sister, obviously I'm going to ridicule you or something like that. That's not the topic here. The thing is, if you shame someone for doing treatments or surgery to improve themselves, I think it's ignorance and it's disrespecting personal choice and disrespecting the freedom of choice. That's what I think.
Yeah, I think there's a lot of discussions about this happening, and a lot of.
But like I said, Dr. Alice, if it's excessive, meaning the person goes overboard and for no valid reason reconstructs their face simply because they hate their face so much, then like you said earlier, there is a problem that is not going to be resolved with any surgery except.
But this has affected me to a certain extent, this shaming that goes on. And even though in the rest of the world over the last 10 years, things have exponentially improved. The perceptions have improved, like what we were talking about, cosmetic surgeries as opposed to plastic surgeries and aesthetic treatments. They have changed what people think about this. But still, I think I have patients, who are celebrities like thyself, they will do a lot of things, but then they are very afraid to say that they did anything at all. They just want to say that they are using their brand of skincare or, something like that, which is ridiculous. I completely respect their choice that they don't want to share it, and we are 100% confidential about our patients. But then they are giving this wrong perception to the community, don't you think? By saying that, at 40 I look so good just by using skincare. You know?
Yeah, it's true, but at the same time, like what I said earlier, it's a personal choice. So similarly, if someone does it and doesn't want to share it or doesn't want to reveal it, that's also a personal choice. But people who shame a person for doing these treatments, aesthetic, plastic, cosmetic surgery, whatever the terminology, the person who shames another person for choosing these treatments, I think the person who's doing the shaming is ignorant and disrespectful. But similarly, there are people, I feel, not to contradict you, but that maybe want to keep it private. Because of people who shame.
But my question to you is this: is it because, like in Malaysia, is a little bit more of a quieter society where we are very secretive about a lot of things? And there's also our majority people who maybe due to their religious restrictions they cannot share. All of this I completely understand and respect. But I think when everybody starts to collectively kind of think that it's a wrong thing,
more than that.
Yeah, it's a little bit more than that, then everybody, even those people who are completely know why they are doing it, and there's no reason for them to be shameful about what they are doing to themselves. They are secure individuals, they are CEOs. Why would these people be afraid of their choices? Why would be?
But then again, it's probably because there are people out there who would
shame them. Yeah, this is what I mean. The society's take on this needs to change. I feel that we need to say that we have to respect everybody's individual choices. That person is more than 20 or 22 years old. They know what they are doing for themselves. They are holding a job, they have a family, they have children, and they know what they are doing. And then look at them. They are looking more and more nicer going by the day. So if we openly start to appreciate, I think all this mentality about lying about it and leading a false life in that way, I think it would change.
I think so. I think that if people don't shame you or don't put you down for doing these treatments, then you talk about these treatments quite openly. I mean, I do.
Because I think it's becoming a social issue. If you look at all the centers just in Jalan Maruf that has cropped up over the last 20 years I've been here, it's no way people are not doing it. Everybody is doing it. But going out there, other than if you are an influencer, then you go from clinic to clinic and you say, I've done this, and you get some money and you say, I've done this or that, That's another scenario that is going on. So sometimes this also creates this false illusion in people that, I did one treatment and I can look like this. It creates the illusion. I'm also very much against that. That's why you may notice that I don't use, unless they are genuine influencers who have really done work with me, I don't pay money to people to talk for me. It's because I'm against it. I'm against what it creates in the society, all the wrongful thinking. As it is, the public's mind, the consumer's mind is kind of, unless they are intelligent like Li Kim and some of my other patients, they actually believe all those photoshopped images, all those heavily made up images. I have patients who's asking me, I want to look like this. Can you make me like this? They are showing another celebrity's picture. And I ask them, can you show me one without makeup and a frontal angle, please? It must not be one that has been photoshopped to perfection. And they can't. They go search in the internet and come up with another picture. Is also photoshopped, It is also heavily made up, maybe slightly lesser made up. That's it. So I think this false illusions are creating issues as well. And I'm finding that in some of my new patients who are coming up, they have this idea that these treatments just are like magic going to give them results. Okay? And I tell them, if you are in kindergarten, you have to go through primary school, secondary school, then go to university, then get the best job. Okay? So that is a process to it, right, Li Kim, which you understand. If you are there, then if you are looking at very discreet treatments that don't show any scars on your face, no marks, no, not even bruising that many people nowadays cannot accept. And in those family members who are actually working to somehow dissuade people from doing these treatments, the minute they have a slight side effect, they are going to harp on it and put fuel on the fire and shame them even more by saying, I told you not to go and do these things and you done this, and and it creates this whole psychological impact of regret and misinterpretation and all that. So this is the reason I hope it will become more open.
But I also, since you brought it up, there are people who have actually done stuff that has adverse effects.
Yes.
And I think that also doesn't help. That makes people go, see, I told you don't do that. Why are you going to put this in there, put that in there? Now you see what happened to your face. There are cases like that. I'm not saying there isn't. So therefore, like for myself, I take responsibility in what I choose to do to my face, or what I want to inject for my skin, or what fillers I want to use for my lips, etc. I take responsibility by how finding a doctor I trust, doing research, reading up about it, and even looking at what kind of side effects are possible, and then talking to the doctor. And in a way, I think when I first met Dr. Alice, I was like interrogating the doctor, because I was researching Dr. Google, right? So I did Dr. Google, and then I met Dr. Alice, and I tried to reconcile my facts. So there was one time I would ask so many questions, it probably even became offensive, but it gave me knowledge. And I learned. And then when I learned, then I make choices of treatments which I wish to improve and I make it based on that. So you can't, as a person wanting to be beautiful, because you can and you are, you also need to be informed. So get well informed, and if it pleases you, you need to maybe see a few doctors before you choose the doctor you feel comfortable and you trust, and you will just trust your face with the doctor.
Coming back to the time I first met Li Kim, I was actually delighted by all your questions, by the way. Sometimes there's people who tell me my consultations take too long. My staff get very fidgety when we have a long, number of people waiting in queue. And, I love these questions, because that means this person is a responsible person. This person has done their research before coming to me. They know the extent of roughly what I'm doing, and they come for this reason. And number 3, they also, according to the information I give, they are going to take back whatever I give them. And I'm very open about this. I will give them brochures and I will tell them, go do your own research. And then if you're interested, you can come back for a second consultation as well. Because these are important things. You don't do just because it's a simple injection or it's a simple laser. Does not mean that will not have side effect. Does not mean only a big surgery will have side effects. You have to understand this, and you have to try and ask as many questions, do your research, go back to the same doctor, go to multiple doctors, as like what Li Kim said. And then these are the people I love working with. And at the end of the day, if you still tell me I'm not ready for this procedure now, I'm completely not upset, because I know what you're doing, and these are the patients I love working with. Okay, I saw this article in the Scottish Mail, and it says unregulated beauticians are carrying out potentially dangerous cosmetic procedures which can disfigure women for life. Okay, and then there are some very scary pictures. Okay, so why do you think this is going on, and what is the scenario in Malaysia? This is from Scotland, but I think a lot happened in Malaysia. Yeah.
From what I have learned, or from what I know, is I've had friends who say, oh, I went to do this, I went to do that, I injected this, injected that, and I say, oh, where did you do it? And then they actually tell me at their beautician. And I was actually quite taken aback, and this is as far back as 15 years ago. And I was taken aback because to me, procedures like this require a doctor. You know, I mean, you go to a pharmacist to get nutritional advice, you go to a doctor for your illness, but why would you go to someone unqualified to put something in your face, under your skin?
But you're talking about 15 years back. What do you think is happening now?
I think the reason why, which I don't think that reasons have really changed, I think maybe less are doing it to go to a unqualified person or unqualified person.
Yes.
But I think most of it is cost. When my people I know go and do these treatments with a non-doctor, is normally based on cost. They
think
are
so.
cheaper. They are cheaper.
But I'm
and
also
apparently
hearing
more
from-
convenient. I'm like, I don't know what's...
I'm also hearing from some socialites that eventually when they ended up with me, either the excuse always being that I did not know before about you, or it's more like I've done something wrong and I need you to correct it for me. But it's always like, oh, that's all you charge? You know, I paid more than that for this, you know.
Exactly. That's why I said earlier, it's so important that when you choose to do these treatments, you make an informed choice.
Yes.
You do research. And seriously, I've been coming to you for 13 years, and some of the people I know have gone to beauticians for similar treatments. It's really not that much cheaper. It may be cheaper in the beginning, but then you also get less and therefore end up going more repeatedly for the results you want. So you kind of like penny wise, pound foolish. And if, let's say, you inject into your mouth and then your mouth no longer looks like a mouth and looks like the behind of some animal, then you will still end up going to the doctor to try to fix that, and that is a bitch to fix. I heard it then is going to cost you much more.
A lot of times the symmetry of the lip is gone, the symmetry of the parts is gone, and then you're going to have to
overstretch.
Yeah, and you sometimes can't really redeem it. I do like very advanced laser methods, going in with a fiber, melting the product, especially those silicone based products that were used and they are still being used till today, you know. And the sad part is, as doctors, we are not allowed to talk about these things too much. Okay, we are always under the purview of the Ministry of Health, and they may come after us just because somebody, snitched on you and said she's advertising, you know, and then we have a high chance of Ministry of Health coming after us. So for that reason, we keep it so realistic. We don't put before and after pictures much. We want to be 100% confidential, going by the patient's requests, and we don't do anything abnormal. But the beauticians are allowed to do all these things. I think it's also the marketing things that is putting a big impact on this. It's cost, yes, like what you said, but the marketing, how much they are allowed to do and how much we are not allowed to do. So the only way for me forward, and this is what I've been doing for the past 20 years or more, is go out and talk and talk and talk and educate people. And I don't get any money out of it, you know, but I want to, at least when I leave this industry, I want to have done something good, you know, so my karma will be good. And Li Kim, look at this other article. I know maybe you have or have not heard about it. Malaysian beauty salon says sorry for model's deadly liposuction treatment. And let me just, I think it was viral, and it kind of affected the whole cosmetic medical industry as well, because there was so much of confusion. In that this beautiful 24-year-old model who was going to get married end of last year, she actually went to a beauty salon in Cheras, and then she tried to enroll for a liposuction. And if you listen to the cost of it, is a ridiculous cost. No liposuction can be done in that cost. You know, so I don't know what corners were cut. Number one, they were not doctors. And number two, it was ridiculous the way they were trying to defend themselves. They were saying, oh, I didn't even conduct the liposuction yet. You know, I just did the injection on her arm and then she collapsed, and then we sent her to the hospital and she could not be revived and she died there. So this is what I'm trying to say to everybody out there. It doesn't mean you have to have a deadly liposuction procedure completed to die. You go to an unprofessional person who does not know how to revive you in the event. In my thoughts, this is an anaphylactic reaction from some cheap local anesthetic or other agent that was injected. So you see, people who are not qualified do not have the access to buy these medications. So they are buying from the black market, and then they are actually injecting without any knowledge of what is the precautions they should take in the event. Because everybody who comes, unless they've done multiple treatments with me, everybody who comes in will raise a red flag in the back of my mind. I need to always be careful about what I'm doing, and have to be ready in case of any eventualities. If you do not have the training to do this, then you can kill anyone, But again, other than cost, which I already told you is a ridiculous cost, why would people go and do things like this? It's, it is really amazing for me. So I thought, you're a social lady, you meet a lot of people.
I am very against, even like I say, when my friends talk to me about doing treatments and they're not going to a doctor or somebody who's qualified, I am very objectional to it. But of course, I can't strap them to the house and lock them in and not do that. But then again, it's a little procedure or some laser to remove some blemishes or something. Okay, maybe that's not so detrimental. But I think, again, it's insufficient information, no self-responsibility to
On the
to
contrary,
get informed.
even for lasers, I've seen people,
Yeah, get
and they are
burnt.
professors, they walk in with boils
burnt.
on the face, burnt terribly. And when I ask them what was done for you, because this is an emergency, and you need to treat it as an emergency and make sure the patient doesn't, scar for life. Number one, if you're an experienced doctor, you will not cause that kind of burn. And number two, even if it happened accidentally, say you are trying some new machine, you're not fully informed or whatever, and the patient happens to be the guinea pig, and you caused a burn, but then you need to know how to treat. So that is why in all my teaching courses, in all my training courses here and in overseas, I always start my lectures by saying, if you do not learn how to treat complications for this particular procedure I'm training you on, do not do that procedure, because it's so important to know how to treat. So if she had been in a clinic, and now there's big confusion about plastic surgeons saying only I should do this, and cosmetic doctors saying why can't I do this, that's going on. But whatever it is, at least if you're a doctor and you have the experience and you have worked long enough with the government to know what to do, that means you are a real doctor, and not just someone who comes out of med school and straight jumps into cosmetic medicine because you think you can quickly earn lots, I don't know what is, or become famous or popular. So then you should go to doctors like this who have a lifelong of experience behind them, and they know how to treat you, because anything can happen. The human beings are so fragile and complex. God made us so beautiful and so wonderful, but it's also very complex. So anything can happen at any time. So this is, my thoughts about this.
It's a tragedy.
It's a tragedy. It's something that the people go and apologize, the relatives at the funeral. It's not going to take away the hurt and the life full of promises lost at this. So if we were all people who can discern, we can do our research, remember always that your face, is, and your beauty and your body is a temple of God, and you have to treat it with respect. Don't just measure it in dollar and cents. This is so important. But then again, if you wanted to try, you can always try for non-surgical, non-invasive, like what you were saying just now. Now technologies have grown so much that we are able to give remarkable results. Not everything like a surgical result, but we can give some remarkable results with some latest technologies. Like Thermage FLX is one of my latest exciting technologies, And for your information, I have used 4 generations of Thermage technologies, and I'm their spokesperson. I internationally speak for them. I conduct talks, I conduct trainings for doctors, and you know, we have let, you know, Li Kim being our celebrity patient, we have let Li
Celebrating
Kim
life.
to do a Thermage FLX treatment on her lower face, right?
Yep.
So I let Li Kim to talk to you about what is her experience, because we are not just about conducting a treatment and saying bye-bye. We are about longevity with our patients. We are about maintaining our patients well. We are about the patient's experience inside our centers.
We are saying bye-bye to some sagging.
Yes, but not
Hello
bye-bye
to
to
some
our patients.
activated collagen. The Thermage FLX, right?
Yes.
It's see, I'm a person that loves the results of the work, but I don't want to feel the pain. So I'm always like, got sedation, got sedation. People might think there's something wrong with me. Yeah, whatever. So, and I was like, okay, because I read on this Thermage and it was supposed to be painless and very comfortable. I was like, okay. I have very low threshold for pain. So I said, I'll do it without. And it was actually a very, very comfortable procedure. I was actually quite impressed because normally I'll be until Dr. Alice would be like, you know, don't scare my other patients. And then I'll be like, it was very, very comfortable. In fact, I hardly felt anything, except I think I'm a bit sensitive around the jawline, which you also prepared me and said, okay, it's going to be a bit more sensitive here. So there was a little bit more sensation, but there was no pain, no discomfort whatsoever. And the best part is I walked out of here. I drove back because no sedation, ma. So I drove back. There was no bruising, no redness. Maybe slightly puffy because after all, you know, I mean, if I were to take your face and punch it, it will be puffy too. But so like, I think Thermage is like, I call it punching your face because it's kind of activating things at the bottom. So it was very comfortable. Slight dryness after that, which is, I expected it because all treatments like that have a certain dryness
It's
effect.
because of the heat energy.
Yes, correct. So
Yeah.
I used my sleeping mask, my hydration mask and stuff like that. You need to know things like that too to get better results as well. So it was very comfortable. And then after all the slight swelling, which after 2-3 days, then I started feeling like a, how do you say? A tightness. Okay, a certain tightness. And but I do understand Thermage will take another few more weeks to see the full results.
lifting, yes.
But I can already feel this. I'm very sensitive to these things because, you know, I'm full of myself.
Of course, I think you also said at that time that it was remarkably fast,
Yes,
right?
yes, and painless. That's the best part.
Because, and then we talk all the time, you know, I do talk anesthesia, I'm an expert because I talk a lot as well. So we were speaking and then she was like, oh, finish, okay, that's it. It was very pleasant, and I'm glad to know that you're starting to experience.
Yeah.
It's now just been about more than a week, I think.
A week?
Week plus 10 days?
Yeah, maybe.
Yeah.
And it starts to, it's, you know, if you can feel it, you don't feel puffy, you feel tight, you feel like angled.
Yes.
I don't know if that's the right
Yeah.
word. Yeah, angled.
So it
it's
improves the angles, and I mean, for someone who has a beautiful, you know, bone shape, this is all we need to do, you know. And I could be telling Kim, let's do a plastic surgery on you, you know, let's do a full facelift. To me, honestly, that is not necessary, so I'm not going to suggest that. But then if someone comes with that much of sagging and the skin is going to be pulled right to the ears, then I may not have a choice, and then we are going to discuss the options, but we are not going to force you to do anything at all with us. You know, if you decided I'm happy at the moment this way, okay, you say some minor changes will happen, I will wait till I'll come back. Though in my mind as a doctor, I think prevention is better than cure. You don't wait too long till everything goes south. But if you say that is your choice and you're happy with it right now, like that, I'm also happy to let you go. Okay? Whatever it is, we still remain friends.
Yep.
Okay. So now I have another article. This is a little bit different, yeah? it's about body neutrality and the art of self-acceptance. I think self-acceptance is very important, right? Yeah. We all need to accept what we are. We all are individual people in ourselves. We all are different one from the other, but that does not make us less beautiful or more beautiful than another person. We are unique individuals, and we need to accept that first. And when it comes to body neutrality, I think it's a big movement now. It's gaining a lot of focus and attention, whereby you're supposed to not excessively love your body in whatever way it is, because I think that's also detrimental. And you're not supposed to hate the way your body is also. For example, if you're overweight just because you have wrong habits, and if you find that you don't exercise enough, you don't eat right, you don't sleep right, and you're starting to have medical issues coming out of it, then I think you cannot love your body at the time. You need to say, I need to change myself, not for the size or shape of my body, but because I want to be able to move freely. I want to
healthy.
To be healthy. I want to be able to exercise. I exercise like crazy. You know why? So I can eat like crazy.
Oh my God, for me it's the same. I exercise so I can
if I don't exercise, then I'm going to be like, oh, I have to limit my calories. But when I exercise, I can still be healthy, but at the same time, I can remain okay for my age, kind of thing. But at the same time, if someone is genetically born with a particular shape, you see, a lot of us are so influenced by Western society. You see, even an Asian model nowadays, all of them are like so tall and skinny, and I think for that kind of tall frames, for Asian to be skinny, I think to myself, and I'm scared, I think this woman is starving herself, So they do that, because Asians, we do have more subcutaneous fat compared to a Caucasian. So we have this ideal about Western beauty, and we are trying to change it for ourselves. So this kind of bad perceptions, can be improved on. So in a way, I do agree with this movement. I hope it won't become, too generalized, where everyone says, this is what I'm going to do despite whatever, and I love myself, So if it is health, take care of your body shape. And I know for a fact that many people exercise and eat right, but yet after a childbirth or something like that, or for aging people, is the laxity of the skin. They can't really get back to the shape that they would like to. But if it is their dream, it is their prerogative to get it right. So they have to go with informed knowledge and consent to a doctor who can do a good, clean procedure. And do not think that there will never be any side effects. This is another wrong thinking people have. If there is a side effect, the doctor has done something wrong. No, because sometimes side effects can happen. There is no surgeon or doctor out there who can promise and tell you, I've done thousands of this and I've not had one patient with side effect.
Well, that's
all of us
another line
do
you
have.
can never.
You
if a doctor
cannot
tells
believe
you,
that.
You can't believe that.
Yes.
Yeah.
So we need to understand all of these things. So I think, Li Kim, if you have anything further to say it now.
I think it's important to like yourself, embrace who you are, and then from there, if you want to change your habits to have a healthier lifestyle, do so. And if you want to fix anything on your face, do so. But whatever it is, make informed choices and be healthy about your choices. Healthy emotionally, mentally, physically.
As treatments are getting more and more holistic, now we have many ways of making someone beautiful, okay? So it is not just about doing the face shape, it's about looking after your skin, keeping that beautiful glow, a lineless face, taut, better looking skin, which is ideal for beauty. 60% of beauty is coming from your skin, so that you can go barefaced without having to wear makeup also. And then it is becoming so holistic in the sense that we are looking at from the genetic point of view, we are looking at how your skin and how your body ages, because the skin cannot be separated and treated separately because it's part of our body. So whatever affects our cellular aging can also have an impact on how our skin age, how our underlying tissues under the skin ages. So there's a lot of ways looking from the genetic part. We can produce supplements and skincare going by the genes, your particular genes, personalizing your beauty regime. We can look at your inflammation part of it to see how much the collagen that we can produce for you with our treatments, how you can hold on to it for the longest time possible. And these are things that is only possible with all the latest advances. So we are into anti-aging practices which age your inside, and then you look beautiful on the outside with minimum procedures. So I hope in the future more younger generation will start to accept the fact that they are unique, beautiful people by themselves. But on top of that, life is not perfect. Sometimes things happen and our body changes, our skin changes, and then you need to approach external beauty, but all the time remaining beautiful and true to yourself on the inside. I think I'll see you again soon in another episode of Alice in Wonderland. And until then, I hope you all stay safe and stay beautiful. You can be beautiful. I hope you enjoyed this video. If you like this content and you want to know more, please like, comment, share, and subscribe. Please have a great day, and I'll see you again soon.